Okay, next up is our guest speaker. Ryan MacDonald grew up in his family, McDonald's Hudson Bay Resort, which has been owned and operated by his grandparents and parents since 1951. I don't think anybody knows Ryan, so. Dr. MacDonald has specialized in emergency medicine for over 14 years. Please give a great welcome to Dr. Ryan MacDonald.
Like a good doctor, I brought coffee. I have some things here we'll put out. These are some flyers that Ann helped me scare up today. Back in the back is Ann, one of our nurses that works up here at the Northwest Specialty Hospital. Thank you for having me. Marlis contacted me and asked that I would come and tell you a little bit about Northwest Specialty Hospital. I'll tell you a little bit about what I've done since I have half an hour to talk.
Talk louder so
Yeah, can you hear?
Okay, I'm trying to project. I'm
Use
in
your
sick.
playground voice, Ryan.
Right.
Playground.
Take it up an octave.
There you go.
I graduated from Timberlake in 2001. I was a second class there. And then I went to Gonzaga University on a ROTC scholarship. For the Army. And then after Gonzaga University, I graduated from there. I went to the Mayo Clinic in Rochester, Minnesota. And I was one of 42 people that got to go there that year. They had 4,000 applicants, so I was lucky to go there.
Impressive.
From small town of Bayview. It was pretty cool. It felt like going to Hogwarts, if you're familiar with Harry Potter. It really did. It was a special experience going to the Mayo Clinic. And then I left Mayo Clinic. I did a year of internship in pediatrics at the Army Medical Center in Tacoma. And then I spent 2 years as a flight surgeon for the Army. I spent a year in Afghanistan, most of 2011, flying medevac. Flew over 100 combat missions, got my combat medical badge, and then I came back and then I trained in emergency medicine, again back at Madigan. That was for 3 additional years. I served as a chief resident, so selected from my peers to lead the residency program. And then I was the director of the ER at Fort Carson in Colorado Springs. An ER level 4 trauma center, and I directed that ER for about 2 years, and then I got out of the Army, and then I started my career as a civilian at Sacred Heart Medical Center in Spokane, where I worked for about 5 years, just over 5 years, and I commuted most of the time from here in Bayview to Spokane to work in their emergency department. And then as of February, I started working for Northwest Specialty Hospital, now in their urgent care. And that's why we're here today. So, Rick Rasmussen is the CEO of Northwest Specialty Hospital. He's put together a pretty all-star team here locally, a lot of local people. We've got a great team of doctors and nurses. We're lucky we've now got primary care and an urgent care in Apple. Right now they have 3 primary care doctors that brought cards. They're still enrolling new patients, and so if you need a primary care doctor, they take most insurance, including Medicare and Medicaid. Right now their appointments are booked out a little ways, a couple of months, but in terms of getting a new primary care doctor, if you've looked around, that's not bad. And then they're bringing on 2 additional providers at that facility as well, so far. So we're lucky to have quite a bit there. At that facility we have a lab, so you can get their blood drawn there. Pretty much any blood test you need, they can do it there. And things are then couriered either to Post Falls or Spokane or sent across the country if it's something obscure. They have x-ray, so if you need a chest x-ray or if you've got fractures, we can do that there. And then if they have things that we can't do there, in Post Falls at the Northwest Specialty Hospital, they have MRI, which is the cheapest between Kootenai, Sacred Heart, multi-care. Rick Rasmussen's a local, and his goal is to really provide value. And so on average, for example, our MRI is something like a quarter of the cost of what you'd pay at inland imaging. We have MRI, CT, ultrasound, all available imaging-wise at Post Falls. So for example, if someone comes to the urgent care at Athol and needs a CT because they're having belly pain, we can get them started, we can get the labs ordered that we need, and then we can send them to Post Falls to get the imaging, and we'll call them with the results. And that's pretty nice because at Sacred Heart, you know, the average wait time by 2 p.m. might be 8 to 10 hours, depending on what you have going on. So it's a pretty huge resource for our community.
Yes.
So most of the doctors there are family medicine certified, board certified. I'm emergency medicine. There's a couple of us there. There's a couple of other ER docs that worked at Kootenai for a long time before they had their big turnover with some of their leadership. But most of the docs are family medicine. And that means that in terms of primary care, they see pediatrics as well. So for whoever that applies to. I don't see too many childbearing age people. Yeah.
Eldest Jones.
So far I've been really impressed. I've been with them for 3 months now, and I think they have a great team. You know, with COVID, all the big hospitals really lost a lot of staff, lost a lot of senior nurses, lost a lot of doctors, a lot of people retired. They just got pretty burned out, and I'll just tell you, and I don't get paid to say this, but culturally going from Sacred Heart, which I love, to Northwest Specialty, people are just a lot happier there, and I think people are getting really good care. So I'm comfortable saying that I would recommend it, you know, to our community. And so that's my spiel. Are there questions I can answer?
I have one.
Here's one in the back.
Oh, actually I have two.
Yeah.
So for emergency room services,